Good evening, team. My name is Sukhvinder Kaur, and I'm a student of Tihomai University in Taranga, and I'm doing a study in their level healthcare and well-being level 3, and my student ID number is 300 57835. And today I'm just giving you my presentation work for the today I'm going to give my presentation work, and today I'm just gonna explain that what is cerebral palsy. Because so for first of all, I'm starting with that one, some of the definition, what is that. And this is the cognitive diagnosis of movement, muscle tone, and posture. Cerebral palsy is due to the abnormal brain development, often before the birth. Is mostly is that the seasons come with that baby's born, and they have to be stay with the whole life on the wheelchair, or they are not developing their brain properly, they are not developing their body properly. And the symptoms including the inverting reflex, properly gain the limbs and involuntary mentions. This appears to be early childhood. Long-term treatment including the physical and other therapies, drugs, and sometimes surgery. Cerebral palsy (CP) is a physical disability that affect movement and posture. CP is an umbrella term for the group diagnosed that affect a person's ability to movement. CP is due to damage the development brain before, during, the after the birth. So there is a one, I put one of the poster on here, just explaining clearly what is that, how it can affect, is kind of umbrella that I make it in there. So this is the cerebral palsy. So the refer, so it, that one is just like a circular, how it comes to the babies, and how it's not a good for that. And that's refer to the cerebrum, which is the affected area of the brain. So this is the brain that will affected on the bones, babies mostly. And when the another thing is when they refer to the brain injuries, that is makes difficult to be development of the brain as well. And the other thing I would like to include in there also, CP is a permanent lifelong time condition, but sometimes of the some of the these sign, CP can improve or worsening over time. People who have CP may also have visual learning, hearing, speech, and it's really affect on most of the effect on the brain development. And then second one is CP does not on its own affect a person is intelligent. However, as many as 30 to 50% of children with CP have some forms of cognitive impairment caused by the sickness condition. Children with the CP are not able to be talk properly, so they can be provide them assistive equipment like communication borders with pictures, letters, and word will comfortable them. We can do regular communication and living skills to work on during daily learning. Constant practice and will help such and child become more self-significant and independent as well. So other thing is use laughter, growth, opportunity, learning, sharing, engage, and encouragement to help children overcome a difficult situation and barriers. They can be encouraged to spend time with family and friends that they feel comfort about opening themselves. And there was a five ways to build the social skills to be child with CP. First one, develop your child interest. Children, first of all, that you have to see that what is your children interest. So if, for example, so if your children have interest any of the sport, game, travel, any other activities, and so music, camping, we should be encouraged. If they are interested in that, we should be participate in that, and we should more and more encourage them. It will be helping develop their brain, and it will get the less disease on it. And the other one is be patient, take a time, try to understand your child, and you should be just always understand your child and just always take a patient, and you never to rush and never to be get angry or pissed off, and that you have to be just use your patience, and just listen to them very calmly and try to understand what they want and what they want to do. And the third one is use the app help children with the communication and the language. There is now is the technological world, and there was so many apps which is helpful children to be make their good communications as well, so they can use it and describe to us. And the fourth one is enroll your child in social therapist. Social therapist is a really good therapist for their children. It will help you their brain development as well. So it is really great. And the fifth one is enroll him in recreational therapy, which is provide the opportunity to practice in social activities led by recruitment therapists. This therapist help to children with the CP increase confidence and acceptance of their condition. And so the next one is for me the holistic model. So this is the model. So this is that it shows there how it will be helping with the well-being, how the we can do the develop there. So this is me. This is around my mind, and that's the social model, and that's all around there. So what we are all the time to thinking about it, and it will help as well. So resources, other professional that may come your home and work with your child, that include the physical and occupational therapist, speech and speech therapist, recreational therapist, home modification expert, adaptive equipment expert, and nutrition behavior therapist and physicist. So there was a reference for that. I will be sending my presentation in that one. So please review this all the references as well. Thank you.